Hello and welcome to the IOSH Trailblazer Talks, a new series recorded at the 2024 Health and Safety event in Birmingham. In this episode, our guests Kevin Myers, formerly of the HSE, and Janet Newsham, a prevalent health and safety campaigner, debate the relevance of the Health and Safety at Work Act. Our last guests into the podcast booth on day 2 of the Health and Safety event are Kevin Myers, who's spent 40 years at the HSE, including Chief Inspector of Construction and Director of Hazardous Installations, and Janet Newsham, who is the Chair of the UK Hazards campaign. They have both just stepped off stage where they engaged in a debate about the usefulness of the Health and Safety at Work Act as it reaches its 50th anniversary. Reflecting on the impact this legislation has had, we want to question its relevance and impact on today's constantly evolving work environment. So thank you both very much for joining me in the podcast booth today. How are you doing?
All right, thank you.
Good, thanks.
Good. So first of all, for our listeners and our viewers, can you tell us a bit about yourselves, Janet?
So I'm the coordinator at Greater Manchester Hazard Centre, which is an occupational health and safety advice and campaigning organisation. And then chaired the Hazards campaign, which brings together all different organisations across the UK around health and safety campaigning.
Great.
Kevin Myers. I joined HSE as a trainee factory inspector in 1976, a year after HSE was set up. Never expecting to spend 40 years there, but I guess I'm pre-Generation X, so I did end up spending 40 years there. Because it continued to tick the boxes for me about doing something that was socially useful, getting out to meet people, trying to make the world a better place. And it's because it's an organisation that does various things. I had lots of different interesting jobs to keep me interested and motivated. I ended up finally as the Deputy Chief Executive. I retired in 2016. I was also chair of the International Association, or president really, of the International Association of Labour Inspectors until 2021. So although I've sort of left HSE behind, I was still involved in the sort of global aspect of that for a while.
Excellent. You're both very, very well placed for today's discussion. So Kevin, how have you seen the Health and Safety at Work Act shape safety at work over the past 4 decades? Or 5 decades even?
Well, it was a transformational game changer. It introduced a completely different philosophy about who was responsible for managing risks. Prior to that, there was a Royal Commission, the Robins report, which recommended a number of changes. It said that the existing law was ineffective. It was all too detailed and prescriptive. And it gave the impression that it was the responsibility of government to tell businesses how to micromanage risks, when in reality it should be the primary responsibility of the people that create the risks to identify them, to control them, to manage them, and to do so in consultation with the people that were exposed to the risks, the workers. So he proposed, and the Act contains an outcome-based approach, which talks about achieving outcomes, i.e. people's risks from health and safety are properly controlled, people are not exposed to them. And that's almost like an eternal verity, because it applies to all risks arising out of work. So as an umbrella framework, I think it's survived the last 50 years very well. And I think it's still in itself fit for purpose, because do you want to change the principles that the people that create the risks shouldn't be responsible for managing them? You wouldn't want to do that. The challenges nowadays are different. We've got a different economy, but the Act, I think, is flexible enough to deal with that.
It stood the test of time. And Janet, you've been an active trade unionist for over 40 years. Do you believe that the Act has adequately represented the needs of the average worker?
I think certainly, I've worked in different workplaces. I've worked in engineering factories and education and not-for-profit organisations. And in the trade union organised workplace, I think it was really effective because it showed that we could work closely with the employer. I think in ones that are not as organised, then it's a little bit more difficult because it relies on the enforcement. It relies on sort of a proactive enforcement approach as well. And I think over the years that the HSC have been, the resources have been cut, their officers have been cut, and that relationship has changed. So in the beginning, the HSC, you would ring up the HSC officer and talk to them about the issues that you had, and now you don't even have a number for them. So the whole way. So I agree. That that framework is absolutely right. And it's adaptable to the risks that we've got. But it does also rely on an enforcement authority that can be proactive, that should be proactive, to hold our employers to account on what they're doing. So it's all right saying, the employer's got that responsibility, and that's absolutely fine, but we know that they're not taking on that responsibility in some industries, some sectors, and therefore workers are being put at risk in those areas, or not able to challenge their employer because their jobs are at risk.
Yeah, of course. We'll come back to what you think's missing from the Act a little bit later. So, Kevin, as former Deputy Chief Executive of the Health and Safety Executive, can you tell us what the view of the HSC regarding the Health and Safety at Work Act has been?
I can tell you what it was when I was there.
Yeah, that's good enough for me.
I left the organisation 8 years ago. We developed a regulatory regime in this country based around A, the Act, and B, the philosophy of that. Obviously, HSE can only do what it can with the resources that it's got. And whilst I understand what Janet is saying, the primary responsibility lies with the people that create the risk. There are now hundreds and thousands of OSH professionals out there working for industry, which there wasn't in 1974. So the idea of self-regulation isn't that it's all the responsibility of the regulator. I think the role of regulation is to make people change, to improve their control and management of risk. And there's an old aphorism about change. There's some change because they see the light, others because they feel the heat. So the job of the regulator is to try and work in a number of ways, through organisations, through communications, through providing a framework of law to enable people to see the light. And for those people that don't, the regulator is the one that's responsible to make them feel the heat. And that's to hold them to account when people have been harmed, particularly as a result of a failure to control the risks.
Yeah, I was going to say it's about accountability. So, Janet, as chair, what's the view of the Hazards Committee on the Act?
I think very similar to what I've outlined.
Yeah.
That it's still relevant, it's still important, but part of the Act is about the HSE and the enforcement, the regulators, and we've seen. I think we would say there's been like a political capture of the HSC in that they've been sidelined. They've been, they're not able to do the job that they need to do
Because of funding.
Yeah, but it's I would say, I know you're saying about enforcer. They've got a proactive responsibility as well. Proactive inspections. We could do a lot more. It seems to me when you go around the stall here, or you're going, you're looking at the website, it's all about making money now. It's about delivering training. It's about, can they get more? There's all sorts of bits of legislation that it's not about that proactive, preventative approach anymore. And we saw that nothing more clearly than in COVID. When they didn't go in and didn't work with the trade unions to do the proactive inspections, didn't take the support the safety reps going in and doing inspections just to help, and to try and prevent people being put at risk.
Yeah, as a health and safety journalist, I've been in the industry for about 20 odd years. So I reported quite heavily on the FIFA intervention scheme when that came in. And a lot of people would say that there was a real shift change there with the HSE, with inspectors, where, like you were saying before, businesses could ring up and get advice, whereas now it's reactive when there's been an incident or something like that. But having heavily reported and having a relationship with the HSE over these years, I've seen that they did recognise that after FFE came in and have strived towards, and you probably saw this towards the end of your time at the HSE, have worked towards trying to get that back. And I've certainly seen that. I don't know if you have and the businesses that you work with have.
Well, I'd say no, really.
Okay.
You know, we don't see that's changed, really. Like, you know, I think they're, you know, hamstrung by it all. Like, you know, I think that's a real problem. You know, that commercialism of the HSC is a real problem. It makes them not independent. You know, they should have an independent role that's independent of commercial aspect, independent of the political aspect, and I think that's the shift we've seen in the HSC that's wrong.
Okay. Anything you want to add to that, Kevin?
One of Robin's comments was you can't improve health and safety in the workplace by just having an ever-increasing number of inspectors carrying out an ever-increasing number of inspections and that. That's not say that. Don't think from that I think that HSE is adequately resourced now. It is not adequately resourced in my opinion, but it is part of the system of government. It has to operate with the finances that it's given. I can't talk an awful lot for what's happened in the last 8 years, but I can talk about the principles, which is it's always had an approach of proactive inspections, thematic. The task is to identify what the priorities are and to concentrate on them, because if you spread the resources too thin, you don't have the impact. So HSE carries out proactive work, not as much as it used to do, but it still carries it out as far as I can see from its business plan, as well as carrying out reactive work. It does. I mean, I just, in preparation for this, I just looked at the HSE website yesterday, and it had a list of recent prosecutions with people fined, you know, tens of thousands of pounds for offences where they were held to account by the regulator for asbestos, for, you know, more traditional safety accidents as well. It's got to balance both sides of the coin.
There's been, I mean, as I said, I'm digital editor of the IOSH magazine. So week in, week out, I report on these prosecutions. They're our most read pieces of content by IOSH members because it's really good. Lessons learned. The inspectors are always really happy to speak to me, give me the story behind the headlines. There's been, in the last couple of weeks, £500,000 fines, £800,000 fines, because with the sentencing guidelines, it's based on turnover as well. But the thing is, it doesn't go back into the HSE. It goes into the Treasury pot, doesn't it? So I personally, I know I'm not being interviewed today, but would like to see a proportion of that. I know they get their costs, but in order to be able to reinforce those resources, I think it's really important.
Yeah. I didn't answer the point about FFI. When you introduce something like FFI, even if it's the best thing ever, it causes ripples and that. So yes, there was some tension and some unhappiness in the first place, but you know, we dealt with that. We responded to it. We improved the appeals mechanism, so if people felt that they shouldn't have been charged fee, and it settled down. And I think there's been 2 reviews since then that have said it's now part of the wallpaper, really, I suppose. Yeah,
the words I was going to use to describe that was it did settle down quite quickly. So yeah, I completely agree. So the world of work has obviously evolved and changed phenomenally. A big theme here at this event has been the future of work. Work has changed since the implementation of the Act. What do you feel needs to be revised to ensure its relevance? So this is going back, Janet, to what we were touching on earlier.
So there's lots of things that are missing in the way that the Act's evolved. We've got a big piece of work that we're going on about work-related suicides, for example, you know, and mental health. we've had 20 years of the management standards that the HSE brought out, which are brilliant, and we're going around employers and we're saying to them, you need to be using the management standards, to do stress risk assessments, to control that risk to people's mental health. And it's really difficult to get employers to take that up unless the HSE came in and actually started to enforce that and started to do something about it. So it's still around enforcement, still around that proactive. And we've sat on committees where HSE officers have actually sat there and said the same to employers, because I do work in the education sector, and the employers are saying, well, what does that mean? Is that individual risk assessments, etc. So there's a whole host of priorities around mental health, because that leads to work-related suicides, it leads to people dying. The tripartite arrangements on the HSE are hugely wrong, I think, at the moment. The TUC put a recommendation forward when a place came up from one of the trade union representatives on the HSE, and that was rejected. Now, not necessarily by the HSE, but by government or whatever. But that meant that changed it's not gone back to a tripartite arrangement. They bringing, as I said before, about bringing REACH coming back into the UK. UK now controlling REACH. In Europe, then trade unions are part of the management of REACH. So they have an influence at all levels of when they're sorting out the work exposure limits. And in the UK, trade unions are not part of that anymore, and they're excluded from it. And so, there's a big shift, I think, in terms of the way that the HSE are using or relationship with trade unions. They're not seeing the trade unions as the worker voice anymore. And there could be a criticism said that, well, actually, as trade union membership goes down, but they're the biggest representatives of workers.
Yeah.
Independent representative workers. So if you ignore that, you're ignoring workers' voices. And, a worker in McDonald's who's not in a trade union, who's being put at risk, their health being put at risk, or working in a factory, that's using chemicals, and they're not a trade union, they're not got a trade union to represent them. Who is supporting that work? How do they get to
their
have
voices
their
heard?
Voices heard and enforcement?
Yeah, absolutely. And Kevin, you're a trustee of Mates in Minds. What are your views on the provision, as leading on from what Janet said about mental well-being? So is there enough provision in the Health and Safety at Work Act, obviously, because it is 50 years old now, and psychosocial risk has really come to the fore in the last decade, hasn't it? Do you think that the Act needs to be revised or added to introduce mental health support into that, or do you think it's adequate?
In terms of the primary act, it is adequate.
Mm-hmm.
Mental health is covered by the Health and Safety at Work Act. But as we know, for different risks and hazards, we also have underneath that sometimes regulations, sometimes a code of practice, sometimes guidance. There's lots of guidance on the HSE website about mental health risks. Janet referred to them. So I don't think the Act needs to change. It is clear that psychosocial issues are on the ascendancy, whereas there's been significant improvements on the safety side of things. There has been an increase in ill health in recent years, and that is a continuing and growing challenge. Some of it would, intuitively you could think, 0 hours contracts and things like
Gig
that is going to increase that. But there seems to be a wider thing in society. The problem is, it isn't a binary issue. It isn't mental health suicide. People commit suicide who haven't got mental health issues, unless you say that committing suicide demonstrates you have. So, and some mental health issues are work-related, others are outside work. So it isn't a straightforward, simple thing. So we need, as a society, to look more broadly at the issue. We need to improve provision of mental health services in the National Health Service. We need employers to be better at managing risks. What Mates in Mind does is an example. It's a charity set up by the construction industry that asked us to create a charity because they recognise that as an issue. In that, and we're working with organisations to raise awareness, to try and destigmatise mental health issues, so people feel able to communicate and say I've got a problem, so people can then help them and that. So yes, it's a real priority in terms of dealing with mental health issues, but it's a complex thing, and it isn't. I think the answer to it is have lots and lots and lots of inspectors inspecting mental health. HSE needs to play its part as part of it, but it is something that needs a real joined up approach within society.
Can I add something to that? Because, we work with families of people who've died at work. One of our organisations that's part of Hazardous campaign is Families Against Corporate Killers.
Yes.
We're working with families of people who've died with notes in their pocket, who've complained to the employer that they're unable to do the job that they're doing, or they're being bullied at work, or that they're, with families that have gone into workplaces and said that my son's being bullied and there's something going on here, and he's died by suicide as a result of what's happened. And we know in France that there is legislation to say that where there's work-related suicide, if there's somebody dies in a note in the pocket or in a uniform, then it should be reported and investigated. And French companies in the UK who are investigating suicides because of the legislation in France. And I think absolutely that must be it must be part of our enforcement. That it should be reported, it should be investigated. Employers should be held to account if they're not controlling the risks to those individuals, and they could be vulnerable individuals, but they could just be individuals who are being overwhelmed by workloads or by the way that they're being treated at work. And I think that's a massive development, and it's something that we need to change in terms of regulation.
And it also comes back to what you were saying, Kevin, about the complexities of work-related suicides and what the causes could be: personal, illness, work-related, and educating the coroners as well, and what's recorded as the cause of death. And do you think that the work-related suicide should be part of the HSE reporting on the fatalities each year?
Yeah, we would absolutely say that. And in France, employers are prosecuted and jailed for putting people at risk and having died from suicide. If they could do it in France, we could certainly do it in this country. It's not about. It's about prevention, isn't it? Of it, it's what.
Yeah,
it's
not about
concerned.
blame. It should be about.
It's about how do we stop that happen? Yeah. How do we make sure that they're controlling the risks?
Kevin, did you want to come in?
Yeah, I just wanted to make 2 points. I see suicides as a tip of an iceberg of, below the surface are the things that go on that lead to suicide. And some may be work related, some might be domestic, some might be alcohol related. There's a whole range of things. The main way to deal with it is to actually get at the iceberg, not the top of it. Not the top of it. So that's one point. The second point is, whilst I understand what Janet is saying, it is also important to recognise differences in countries. So France is interesting because, first of all, France's equivalent of HSE is actually a labour inspectorate, and it enforces health and safety, but it also enforces broader work conditions in a way which are almost deregulated in this country. Also, there is a much higher role for their state-run social insurance systems. So the combination of the three of them, I can see why they then might come to one solution, which would be much more difficult to actually engineer in this country because of the way in which we deal with those three issues: health and safety, general working conditions, contracts of employment, and that, and also insurance.
And also, it's important to recognise that it actually came off the back of a mass of suicides, didn't it, at a telecoms company? So that's where it came from. Okay, so going forward, what might need to be considered to future-proof the Act? We've agreed that, Kevin said that the Act has stood the test of time, but going forward, there's so much change, Kevin, in the world of work at the moment, with technology mainly. Do you think the Act needs to be future-proofed?
I don't think the Act needs to be future-proofed, but HSE is the prime mover within the system, and you can only act as a prime mover if you've got enough resources and inertia and capability to do it, and it gets increasingly hard. So I would support Janet in terms of saying that there should be extra resources. What we need to do is to identify the new risks that are coming over the horizon and make sure that the people that are creating those risks are cited on them and are understanding that it's their responsibility, if they're developing some AI system, to ensure that they thought through the health and safety implications of it. So you don't need to change the Act to do that.
Mm-hmm. Janet, have you got anything to add to that?
No, I mean, I think that's right. You know, we want these employers to be held to account. So the resources in the HSC is really, really important. And I think we want to go back to, how it was introduced. The HSC role about a proactive, preventative approach to it. To making sure that employers are taking on that responsibility. And if they're not, so how do we know if they're not? Do we know it by reps being able to ring up somebody and saying, there's a problem here, we've been doing everything we can in the workplace to solve that issue, but we can't do it, so the HSE need to come in, or by an individual workers that are trying to resolve the issue, they're being put at risk. How do they deal with it? It was brought in on the basis of really good trade union organised, structured industry, big industries, and now we've changed into smaller, more vulnerable sectors, vulnerable industries. And I think that we have to look at how we can support those workers. And workers are at the centre, isn't it?
Of course,
And it's how, and I want to see the HSE say, this is the good that we've done as a result of doing this enforcement, or it's more about the what they've prevented, how much how people's health has been improved, that sort of conversation, changing it into that sort of way.
And so I mentioned earlier, you both took part in a panel on the Health and Safety at Work Act. It was titled The Good, the Bad and the Ugly, which was interesting. What do you hope that attendees took away from that session, Kevin?
I hope they took away from it that intellectually the philosophy of the Health and Safety at Work Act is sound and robust and provides a framework for ensuring where the responsibilities lie. And I hope an audience of IOSH professionals will take that away and take that back to the workplace in order to think about how they can assist their management in controlling and managing the risks in their business, particularly the emerging risks and that. And I would encourage those workplaces that to go to their IOSH professionals as well, because there is a significant community of them out there in industry. It's unrecognisable from when I joined in 1974.
Janet?
Yeah, I think in the Health and Safety at Work Act, it's a positive, progressive act. It made workplaces safer, but there's the way that work has changed needs to be brought into line, to be supported better by the Health and Safety at Work Act, and they do that. We do that through enforcement authorities. We do that through, making sure that they understand that, I hear what you're saying about the professionals, but not every workplace has got one of those professionals in them. And some of the more vulnerable workplaces don't have those professionals in there, and nobody's supporting them. Nobody's making sure that they're safe in the workplace, and nobody's challenging them. So we've got a whole host of work that needs to be done, really, to make sure that people are safe in work and they're healthy. The 50,000 people that die because of work-related diseases is still not good enough.
No.
We've got a long way to go, really, to make people safe and healthy at work.
Well, thank you very much, both of you, for joining me today in the booth. It's been really, really interesting to get your perspective on the Health and Safety at Work Act as it turns 50. So it was great to meet you, and thank you.
Thank you very much for
asking us. Thank you very much.
Thanks for listening. Join us next week for more Trailblazer Talks from the IOSH podcasts.